2 years into the pandemic, the COVID-19 is still wreaking havoc around the globe. Currently, we have 300 million cases around the world and 5.5 million deaths. Many countries and regions are still struggling to find solutions to deal with these new outbreaks this winter. And just a few days ago, the United States hit a global record, 1 million reported cases in a day. How is that even possible? So today, I invited a guest, a political activist from the United States, to tell us more about the COVID situation in the US. Welcome to Talk It Out. I'm Li Jingjing. Joining me today is Sara Flounders from New Jersey. Sara is the co-director of International Action Center. As a political activist for over 50 years, she has organized solidarity delegations to countries that have been devastated by US wars and sanctions, such as Iran, Iraq, Syria, Cuba, and Venezuela. She is also the co-editor of Workers' World newspaper. She co-authored over 10 books, and her latest book is called Capitalism on a Ventilator: The Impact of COVID-19 in China and the US. So Sara, welcome to the show, and also congratulations to your new book.
We're very glad that as of today, there's a Chinese translation. It is published in China.
So before we talk about your book, I remember just at the end of last month, you texted me and you said I tested positive for COVID-19. So it was quite shocking to me as well. I'm wondering, how are you feeling now? Are you feeling any better?
I'm feeling better, not all better. I've certainly turned the corner on it, but it's a little over 3 weeks now, and I'm still highly congested. I have extreme headaches and vertigo and things like that. But it's a nasty virus. It hangs on. It does different things in your system, but it's not for me. I am vaccinated. I had the booster shot. So I think it's not as severe as it is for people who have no protection.
So you took 2 vaccines. You took the booster shots, and you took all precautions, but you still infected with COVID-19. How is that possible?
The implications of it are what to me is frightening, because it means that this virus has evolved to where it is so highly contagious and it's able to break through the vaccines. Now, it's true, the Omicron, not as serious, not as deadly if you're vaccinated and so on, but viruses evolve constantly. So now we know that the virus can break through the vaccines. No protections are being taken. It will mutate further. Will it mutate in an even more dangerous direction? I don't know. So, and so many of the people who are sick are people who are vaccinated, and they're simply told, oh, don't worry, you won't die of it. So, it means that whole parts of the country are really shut down because people are unable to work. I mean, 1 million infections a day. You can't even comprehend what that means. And yet business goes on as usual. It is, I think, stunning. We didn't expect this. And of course, when I tested positive, I was in a rage. I really was. And if anything, it fueled more this anger at the way in which this virus has been dealt with, or not dealt with, almost ignored.
Apparently you got 3 shots, but I remember you told me in the text that you feel severe pain in your body, your head. It sounds like the symptoms were still pretty strong.
Yes. Not so. My oxygen level was all right. I didn't end up, needing oxygen, respirator, ventilator. That's all to the good. So my fever didn't spike. That's important. But at the same time, this was no joke. You know, I was feeling pretty sick. And I think that is what, by simply saying, "Oh, this isn't so serious," and they've even changed the quarantine, the isolation times. It was 2 weeks, and it was 10 days. Now they say 5 days. Now they say, well, if you don't have symptoms, just come back to work. The directions that people are being given and being expected to work even when they're not well is also, really, this is not an approach to medicine or to healthcare.
You wrote several articles criticizing the whole response of U.S. government and U.S. healthcare system in dealing with this whole pandemic. So what's your observation? How did the whole healthcare system or the government failed to really help the people who needed the help?
Well, there is no public health system in the United States today. I mean, that doesn't exist. There is no coordination. That's a problem. So even in the vaccine rollout between cities and states and counties and how it was being distributed and where you could go for a vaccine, complete uncoordination. And this was true in the early measures of every state had its own rule, and then every city had its own rule, and different counties had rules on whether to wear masks or not. What were the mandates? Completely changing and chaotic. So the lack of any measure of coordination, and at the same time, an insistence that the solutions be in the hands of private corporations in areas where they could make a profit. So even the tests, China immediately developed a test, told the whole world how to make it. Countries started making it. The United States did not use those tests until another test rolled out, which turned out to be a disaster, and then still another one that one corporations could sell at a profit to the government to be distributed. So from the beginning, the rollout of testing was completely chaotic and profit driven. All different corporations, and the testing done through all different private corporate labs. And then the same thing happening with the vaccines. The hospitals operate in the same way. Every service is contracted out to different competing, not even using the same software. I mean, it is difficult to even describe at what level when there is not coordination. Now, just to give a comparison, there is coordination in the repressive apparatus in the US. They can run your fingerprints and come back with a match, or come back, or an iris scan within about 3 minutes. But sending in tests even to the CDC and getting counts and numbers, 10 days we're talking in the beginning, or even now the antigen tests, testing for variants, is hardly done in the United States compared to other countries. So when countries announce a new variant, it's as if it came from there. And so when South Africa announced the Omicron variant, the response was similar to what it had been to China. It was a racist response, and it was to block all flights coming from South Africa, even though the next day Europe announced that the Omicron was everywhere, but they didn't block flights from Europe. So it became known as a South African variant. With a really a racist tinge to the whole reporting and description. It was because South Africa was testing for variants. The United States was hardly doing that. And between sending the tests and it being measured was a 10-day wait. That's very slow when you're talking about viruses. I don't want to get too technical here, but these are the real problems when you have no coordination, not enough
Mm,
testing, and it's all being done by just a hodgepodge of different companies, each
mm,
operating on a for-profit basis. So it's the same thing with how every doctor, I mean, the doctors and medical staff, they care desperately. They're trying to give the best care they can. But the hospitals, there's actually a lot of hospital shutdowns because they can't operate at a profit in this environment. So they simply have to fold. Now, that seems hard to even comprehend how that could happen, but uh, that's the reality in where everything is organized to make a profit or not. That's the first measure. The same
mm.
things happen on the drive to open restaurants and businesses.
And also, you earlier you mentioned you think there's a lack of coordinations in the United States that led to this epic fail, this huge outbreak of pandemic. I mean, what's the situation? What's it like in the United States now? Are there any restrictions or measures to reduce the movement of people, reduce gatherings, just to reduce the infections at least a little bit? So, is there any measures that you think different states, different cities are taking that are useful?
Well, there's certainly lecturing to reduce it, but in practice, when restaurants and businesses uh, stay open, when airlines can book tickets and people can go anywhere, the airlines can't fly because so many people are sick. I mean, 1,500 cancellations of flights. That leads a lot of chaos at the airport. I mean, there you have thousands of people packed together. That can't be healthy. So, and I just want to say my own experience in even trying to get tested for COVID. Um, there were just hundreds of COVID testing sites because any lab could set up, you could set up a card table and do tests. You get paid for every one of them. But as soon as there was an outbreak, they couldn't keep any of those situations staffed. So we stood in line for hours in the freezing cold. And then there was only one person operating this clinic that should have had many people. Everybody else had called in sick. We went to another place and stood in line that stretched out to the highway, and then turned out that it wasn't open. They hadn't notified anyone. There wasn't even a sign on the door. Went to a third place. I'm just describing my own experience in trying to get a test. So, and I'm not the only one. I mean, I see how long the lines are. And how difficult the testing is.
We're denying us a COVID test. We're standing in line. We have an order number. I was told to stand in line and have an order number. I've tried for 4 days to get a COVID test. I'm a doctor. If I go into the hospital and I spread COVID everywhere, what are you going to do?
When they say 1 million people tested positive in a day, you think of all the people who just couldn't stand in line because they're seniors, because they're in nursing homes, because they're disabled, because they have kids at home. So, and by the way, this million testing positive does not count the rapid tests, the at-home tests that they give out. That doesn't get rolled into the CDC count. Only the lab tests do. So I can take a rapid test at home. I test positive. Who do I report it to? And I first did take a rapid test at home, tested positive, knew I was sick, and yet, okay, I know, family knows, but there's no government collection of that data, no way of having any local agency or state or national that's gathering that. So that's another complete disconnect.
So that means even the 1 million global record of reported cases in a day is still under reporting.
Big underreporting, because these are the people determined to stand in line and get tested. So you can picture those who couldn't, or those who took the rapid test, knew they were sick. Okay, they stayed home, hopefully, and now they have 5 sick days, no longer 2 weeks. At any rate, that's this standing in line for care. I tried to notify my doctor, and everyone in the office was out sick except for one doctor, who, after quite some time, was able to do a phone conference. But she explained to me that the virus medication that had been available even 2 weeks before, that was helpful in and for which I would qualify based on age and health conditions and so on, was no longer available, because everything in medicine in the US is done on what's called an on-time basis. You don't order anything until it's already a need. Now, this is what happened early on, when there wasn't even masks, because there wasn't anything in stock. There wasn't anything on order. This just-in-time way of doing everything means that you had hospital staff where they're using plastic garbage bags for cover, and shower caps, and tying bandanas on their face. This is nurses in a hospital, emergency room technicians. So anyway, these are the breakdowns that happen, and you think to yourself, how is that possible? Why can't I reach a doctor when I need to reach a doctor? And it's not that the doctors don't care, but they're operating in a system that is, so very competitive and broken down.
You mentioned a little bit earlier, because your new book, Capitalism on a Ventilator, The Impact of COVID-19 in China and the US, you actually wanted to publish the English version of this book in the United States, but somehow it was taken down. The publishing houses in America refused to publish your book. Why?
Well, Amazon is about the largest online distribution center. We were trying to publish at a time when most publishing houses, along with many things, were shut down. And so when we got this notice refusing, unless we redrafted the book, changed the title, and all of that. So what we did was we did a fundraising, found a small private printer who would print it, and began our own distribution. We tried, and this was a project of the International Action Center and the China-US Solidarity Network. We even tried to advertise the book, and were told by the largest, they simply send out media releases. They would not touch this topic. So that to us it wasn't just an individual Amazon choice. This comparison was not being allowed. Now, if we wanted to publish a book talking about China as authoritarian, saying their measures were terrible, we'd have no trouble finding a publisher or finding funding. There is open access to funding on material that attacks China. The idea of learning from China, examining what they're doing, and this was the people who were writing these articles. We had 50 different authors who have campaigned, some of them for years, for a public health free public health in the US, which is a very difficult campaign, as you can imagine. And other commentators looking at what's going to be the impact. Now, these were people who in the past maybe had worked on why is the level of diabetes so high here and the level of untreated heart conditions and whatnot. So they were looking at it through that lens also. They contributed articles to the book. Anyway, I'm just saying that kind of examination and comparison and critique is not allowed in the US, not allowed by the publishers, by the advertisers.
Their problem is that you cannot say China is doing a good job containing the virus, or you cannot compare. So you cannot praise China.
You can't compare 0 COVID deaths to 800,000. No. that is propaganda. That is now they have lots of forms of propaganda that are completely allowed, but this would not even be permitted. So that's true. We found a private printer, and we're able to distribute sell some copies of the book, but not in any way what would be a normal book distribution route in the US. So much for freedom of the press.
That's what I want to ask, because we were told one of the most one of the things that Americans most proud of is the freedom of speech, freedom of press, right? So why they are not supporting you to publish this book?
Well, you would think it would be obvious and easy, but it's not really even the way the corporate press operates. It's highly coordinated, and they have a line that they take. They push it relentlessly, and anything that is opposed to that, of course, we found the same thing for years when the U.S. is aggressively mobilizing for a war and demonizing the targeted country. Anything that opposes that is simply not allowed in the mainstream media. Doesn't mean you can't make an individual flyer, but any possibility of it really being part of the mainstream discourse is barred. It's just cut off. So I would say that the people who were cooperating on how do we discuss COVID were folks who have dealt with decades of restriction on not being able to discuss U.S. wars, U.S. sanctions. Now a third of the world, the United States has sanctioned. And they've done the same thing with countries' access to the COVID vaccines. If you're sanctioned, you don't get access even to the vaccines. So we already knew that there is this difficulty in challenging the official story. And the official story is always full of propaganda and assuring people that it's much worse somewhere else, especially much worse in the country that's being targeted at that moment.
Like China.
Right, China, absolutely. They can't say China without saying authoritarian, without talking about the lack of individual freedom and so on and so forth. So and the government being all pervasive, and there's no discussion even allowed of a very vibrant grassroots and neighborhood associations that exist. There's no understanding in the United States of that, because what could you compare it to here that people have experience with? There isn't anything to even make that description.
We've seen in the past few decades, the U.S. government and the military-industrial complex were really trying to export the democracy, the system that America has. Even now, we still can hear how these candidates for president were praising the system that the U.S. has and how it changed the American's life. I mean, you as a American citizen, do you feel this system will really help each individual that living in the United States to have a better life? Does all this democracy and freedom that the U.S. government was bragging about can really help every individual in the society?
Democracy is a very hollow, empty word here. It really hardly exists. And this is understood, even by the average person, that it takes millions and millions of dollars to run for office. You have to be backed by big money. That's not democratic. And at the level of freedom, yeah, you can be free to be homeless. You can be free to lose your job. There's all kinds of freedom that we have here, but there's not free education. There's not free health care. Actually, most young people are already deeply in debt, deeper in debt than their parents, just to pay for an education. So there's very little that's actually economically free or socially free, and yet the term freedom is used. The terms democracy and freedom are used, saluted, flag raised, but whether it's a reality, I think there is an understanding that that isn't so. Voter suppression is absolutely reality. That's being passed through every state legislature, how to restrict, how to make sure less people vote, how to cut people off the rolls, particularly Black people, people of color. This is the reality. And actually, it's not challenged by the Democratic Party. It may be a policy of the Republican Party, but it's not really challenged because they also know it takes big money, multi-million dollars to run. Well, in the name of freedom and democracy is also how the United States has fought one war after another. I mean, in my lifetime, the United States has never not been at war in another country. And this is even more so true for young people today, since 9/11, since 2001, really Afghanistan, Iraq, Libya, Syria, massive wars of destruction, and the soldiers who are sent to fight, the rate of suicide afterwards is higher than the fatalities when they were there, because of the role that they played. I think it plagues them afterwards. So, but all this was done in the name of freedom and democracy. Drone attacks, that's freedom and democracy. And so that really means, because the opposition to the war is really there. They do all kinds of polls, and no matter what, people don't want another war and don't believe in the wars. Now, that's important. It means that they're having more and more trouble selling their wars. They can call for, Biden has a summit on democracy. Who does he invite? It's the dictatorships around the world. So, it's a political vehicle, but it's a very empty term, and it doesn't have much allegiance here. It does for the major politicians. They can't operate, can't get a platform in the corporate media unless they all salute to freedom, democracy, and the flag. But it doesn't mean it's a real policy, and no one really expects that in Afghanistan or in Iraq, they were bringing freedom or democracy. It was about corporate domination, control.
Thank you so much for taking this interview when you are still sick. I really hope that you recover soon. Thank you so much, Sarah, for taking this time. Thank you.